Welcome back to the show, Talk with Your Doc. And with us today is Dr. Armour Boake, who is a nephrologist at Thunder Bay Regional Health Science Center. Dr. Boake, you were talking about a dialysis process, and then patients with long-term dialysis can choose to go for transplantation. So who qualifies for the transplantation?
So transplantation, you have to be healthy enough to both survive the operation and the effects of the medications that will prevent your body from attacking the kidney, and to show that you will be able to look after the new kidney. So for the major operation, we have to make sure that your heart isn't strong enough to undergo a major operation. Because we're going to be lowering your immune system so your body doesn't attack the new kidney, you have to not have something that your body's keeping in check, like a cancer or an infection. And then, because it is very important to attend meetings regularly with your health team and take medications on a very strict schedule so as not to have the kidney be lost, you have to be able to be mentally and emotionally ready to do those sorts of things. So people with issues of addiction or mental health issues have to have those treated or under control so that they're able to take care of themselves.
So once somebody gets a transplantation, how long he can survive with that transplanted kidney?
There are two sorts of kidneys that people get. One is from someone who has passed on, called a deceased donor. Again, everybody is different, and it will depend on how well your body accepts the new kidney and how hard it's fighting. But we say it's about 8 to 10 years as a rough rule of thumb for a kidney from someone who has passed on. If you have a live donor, someone who is willing to give it to you, those kidneys last longer in general. And rough rule of thumb is you can expect 10 to 15 years from a live donor kidney. Sometimes it's longer, and sometimes, unfortunately, things happen and it doesn't last as long, but those are rough guidelines.
So live donor means, you mean to say somebody from the family or with the genetic matching can survive longer with the transplanted kidney, is that correct?
Yes, a live donor is someone, it doesn't have to be a relative, but it has to be someone with whom you have a relationship.
Okay.
So it could be someone you've known a long time from work, or someone from your church or other social group with whom you have an established relationship can give a kidney.
So if somebody wants to donate a kidney, then what is the procedure?
They have to contact the transplant nurses at Thunder Bay Regional Hospital in the transplant clinic and indicate they're interested in donation. They'll be given a health questionnaire, because the most important thing for a donor is we have to make sure that you won't need your kidney back 10 years from now.
Yes.
Some people will say, I will happily go on dialysis in 10 years if it means my dad can come off now, but we don't allow you to make that trade.
Mm-hmm.
And then there'll be some blood typing and some education around the process.
Now, once somebody receives the kidney transplantation, what is the recovery time for him to come back to the normal life?
The recovery time because it's a major operation, we say it's probably about 3 to 4 weeks. Things are quite fast nowadays. You're probably out of the hospital in Toronto is the center we use mostly, although we have people also go to other centers such as Winnipeg or London in a week, and then you'll be watched closely in that center for another 3 or 4 weeks. Then you'll come back to Thunder Bay, where you'll have to come and visit the clinic at least twice a week for several more weeks, and then as things go well, the visits go to once a week and once every 2 weeks, and so on and so on.
So usually from the time of surgery to come back to the normal life, we can say up to 2 months, is that?
We tell people in terms of going back, say, to work, again, depending a little bit on what you work and how heavy lifting or other things you might have, probably about 3 months.
Okay, okay. And now what sort of lifestyle changes required after one receives the kidney transplantation?
Your new job is to look after your new kidney. The first year in particular is the most important year. If things go well the first year, then you're likely to do well for a long time. And so that's, again, being scrupulous in attending your medical appointments, taking your medications at the right times, looking after the rest of your body, care of yourself.
Can somebody continue his work in a regular way, or is there any restriction on the type of work he does?
Depending, most people can go back to work. It depends a little bit on the kind of work you do. If your job involves heavy lifting, then that might be a longer period of time off work. Or if you're working in a particularly dirty environment where you're at risk of getting an infection, that might require a further period of time off work.
Now, sometimes transplanted kidneys get rejected. We call rejection of the kidney transplantation. So can you please tell us a few things about transplant rejection?
So your body is designed to fight things that are not you. Usually there's a virus or a germ of some sort. And so your body is going to recognize that this new kidney is not you. But we have no way of telling it that it's a good foreign thing. So it's going to want to attack it. And so what rejection is basically your immune system, your body recognizing the kidney is not you and trying to fight it off. And so then it uses all of its normal weapons and to damage.
To attack the kidneys.
To damage the invader, not realizing the invader is here to help.
So how can we prevent that damage, or what are the treatment options for the damage caused by our own immune system?
So what we do is we suppress the immune system, we quiet it down so it can't fight off as well. And those are a number of different sorts of medications that will put your immune system slow enough that it will actually tolerate the kidney. Of course, that puts at risk of other infections from other not friendly sorts of bacteria and viruses, and so often people will be on antibiotics or things to prevent infections, and they must be very careful, particularly in the first 3 months and the first year, for all sorts of infections from viruses and bacteria of other sorts.
So healthy living during that transplantation period, avoiding the infections, is very, very important.
It's very important to wash your hands and be careful of not going into social situations where people might be sick or if you feel sick, and to keep very close contact with your medical team.
Post-transplantation, can somebody continue smoking or drinking?
They can. Smoking, there's been studies that show smoking will take 2 years off the life of your transplant at the very least. There are some centers that will refuse to transplant smokers because of the injurious effect to the kidney. But most other programs do, and our programs do, although if you can quit smoking, that will be the best, if not probably the hardest thing you will do, but the best thing for your health.
So maintaining that transplanted kidney in a healthy life by healthy living is very, very important for us.
Yes, again, the more healthy you live and treat the rest of your body, the longer that kidney has a chance of living and working well.
Thank you, Dr. Boake, for coming today and guiding us so much about the kidney disease. And to summarize, taking care of the kidney by monitoring our blood pressure, monitoring our sugar, low salt diet, and lots of fluid is very important. Is that right, Dr. Boake?
That's right. Thank you very much for having me.
Thank you, Dr. Boake. Thank you. Thank you for watching the show.